Welcome back to Pulse Television. I'm your host, Mark LeMay, program of the Greater Lawrence Family Health Center. Our guest, Dr. Joseph Gravel, Chief Medical Officer at GLFHC. The second segment, and probably our third segment, I think it's going to take a little while to answer some questions. And again, we invite our audience to ask questions if they have any. Healthcare reform. It's a buzzword, it's a catchphrase. We keep hearing things like healthcare reform and Affordable Care Act.
Yes.
Try to shed some light on that, and I don't think we have a whole show just for that, but
sure.
I'm sure you can help us decipher what that is.
Sure. Well, certainly being a presidential election year, there's a lot of discussion about particularly with Governor Romney running for the Republican nomination, there's a lot of discussion about what happened in Massachusetts in 2006 with the healthcare reform in Massachusetts. And so certainly there's a lot of rhetoric going on right now as far as healthcare reform, and people put labels on it. And I think the important thing to think about with healthcare reform is the word reform. Is what are we trying to reform? The question is, do we need to reform? And in Massachusetts, there was a recognition in 2006 that there was a need for reform for many reasons. One of those is access, that there are many people in the Commonwealth that did not have access to health care, primary care in particular, and specialty care. And so what would happen is they go to the emergency department. And that was costing the state a tremendous amount of money. There also, employers, small businesses were looking at healthcare premiums continuing to go up, and there was a recognition that we had to do something about costs. So healthcare reform was an access issue, and it was also a cost reduction type of thing. When people talk about cost reduction, people get very anxious about the R word, rationing. And the fact is, if you're on the front lines in healthcare, you realize that there was a lot of rationing going on already. It was covert. It was under the radar.
Define rationing.
So rationing is most people's anxiety about rationing is this aspect of we only have a certain amount of resources, so we're going to figure out who gets those resources. So the rationing can come in different ways. One way that historically has been is if you have money. So the people who have the money get health care. The people who don't have money don't get health care. Other people are concerned about the word rationing, meaning is that going to restrict their ability to see the doctor that they want to see, if they want to go to the hospital that they want to go to. So it's a very loaded term, rationing, but again, I think a lot of people that are on the front lines will say that we've always had some sort of rationing. It's whether it's an economic sort of rationing or whether it might make more sense to really look at what's driving the costs.
Your take?
So what's driving the costs is an over-reliance on subspecialty care and technology. If you look at why the United States needs to look at healthcare reform, and regardless of where you are on the political spectrum, I think there's a recognition that healthcare costs way too much. I grew up, I went to Tufts Medical School, and I grew up, in the medical community with this thought that we have the best healthcare system in the world. And that's really been something that you hear all the time. You frankly hear it much less now than I did when I was going to medical school. But if you actually look at results, if you look at outcomes, if you look at what actually is happening to patients and the outcomes that they're getting, by any measure, the United States does not have the best health care in the world. It's best at one thing, and that's spending money. We're more than twice as much as the second country in the world. And if you look at the outcomes of those countries, we're about, the World Health Organization says we're about 37th in outcomes. So
is that tough to say as a doctor in the United States, though? Is that, because you grew up with that mantra, that we are the best,
yeah.
In reality, we're not. Is that tough? Is that a tough pill to swallow, so to speak?
Part of the reason I chose to go into primary care is a recognition that there was kind of an over-reliance and over-emphasis on subspecialty care and technology. I think it's important to say, it's not to throw the baby out with the bathwater in terms of our system.
Mm-hmm.
we have the best system in the world. If you have some rare conditions, our technology is the best in the world. So there are some things that the U.S. healthcare system does better than anyone. But in terms of preventing disease, in terms of improving lifestyles that result in cancer and heart disease and other things, we're by no means the best healthcare system. So it really, you have to look at what specifically we're talking about. It's really wonderful to have the institutions we have in the Boston area. They are world-renowned, and they have a right to, to that reputation. But in terms of primary care and healthcare, if you look at where we're spending our healthcare dollars, only about $6 out of 100 are being spent to prevent disease still, even though there's a lot of discussion and there's some recognition that maybe the best thing to do is not wait for the diseases to always happen and then be heroic about it and rush people into the operating room and save their life. But maybe if we really pay a lot more attention to preventing those in the first place is where we should be focusing more. So if you actually ask the physicians in 2009, the New England Journal of Medicine actually asked over 2,000 Massachusetts physicians, and that's not just primary care physicians, that's not just family physicians, that's not just community health center based physicians, that's everyone in the state. They had about 2,600 physicians that they asked, and 70% were in favor of the 2006 legislation in Massachusetts. 13% were opposed. So that's not something you hear in some of the debates. It's not something you hear. But from a physician perspective, and that did not break down differently between primary care and specialists. Most specialists are in favor of access. To be a physician and be in the position of knowing what a patient needs and not being able to do that because they don't have the money is a really horrible position to be in as a physician. So providing our infants and children preventive medicine, there are a lot of states, we somewhat take it for granted frequently in Massachusetts, but there are a lot of states where kids don't get their immunizations, they don't get health care that they need.
Let's touch upon, and again, politics aside, let's touch upon the differences between what's going on nationally and what happened in Massachusetts. Again, putting the rhetoric aside, is there a difference? Are there subtle differences? Are there major differences? And is it better to be a patient in Massachusetts than the other 49 states?
So the answer to that is yes. It is better to be in Massachusetts. Our resources are greater. If you look at our costs, they're also greater. Now, a lot of the rhetoric has been that the healthcare reform has shot up the cost of healthcare in Massachusetts. The fact is that the reason for the healthcare reform in Massachusetts occurred because of the cost. We've always been number one or within the top 5 in the entire country in healthcare costs, and there's a reason for that. If you look at where people get their care, it's actually very important in terms of the cost. In the average person in the United States, as far as do they go to a tertiary medical center, these big famous institutions, or do they go to a community hospital? And the national average is about 19% of patients are getting their care in tertiary centers. About 81% they're getting their care in community hospitals. In Massachusetts, it's about 41%. It's more than double the percentage in Massachusetts compared to the rest of the country. So that does drive the healthcare costs, and all you have to do is read in the media now and many discussions about the insurers looking at incentivizing patients to go to community hospitals. That gives some people pause because they say, well, isn't the world famous whatever hospital, isn't that the best place for me to go? And I would say for certain very specialized things, that's the best place to go. But for the vast majority of problems, there's actually been a good number of studies that show community hospitals either outperform or do just as well as tertiary medical centers. So, it's a very complicated issue. But I think one of the things we do need to look at is the whole concept of getting care in your own community, whether it's your outpatient care in a community health center or a physician's office, and getting your inpatient care in your own community hospital. And you know, for a lot of reasons, I think it's important that we support community hospitals.
You're not just the chief medical officer, you also treat patients.
Yes.
How, from a healthcare provider perspective, has healthcare reform worked in Massachusetts?
Primarily, it's the issue of getting patient services that they need. If you look at, again, percentages, you know, pretty much 99.2% of children are covered, and it's about 98.1% of adults are covered in the Commonwealth. It's the highest in the country. You have other states where the uninsured rate is over 25%. So as a clinician, again, it's very difficult to be put in the position of knowing that somebody needs something, and particularly with things that are low cost, like immunizations and you know, very small cost items. It still can be a barrier to a lot of people. So I get to go around the country, talk to other physicians and other family physicians, and frankly, a lot of them say, "Oh, you're from Massachusetts. It must be horrible up there," you know, because we've heard all this stuff about the healthcare reform, and actually, when you give them the data and you explain that I'm never in the position that you're in of turning somebody away because of a payment. And that, in fact, it's a smarter way to go, because we can prevent more diseases. We can, if we invest in the primary care infrastructure in community health centers, then you know, definitely both in the short run and in the long run, we'll save a lot of money. People won't have to be paying so much of their hard-earned income on health care, and it would really help the entire economy.
We're going to continue on healthcare reform, and we're going to bring back in the conversation of community health centers coming up as we continue with Dr. Joseph Gravel, the Chief Medical Officer of Greater Lawrence Family Health Center, right here on Pulse Television. We'll be right back.